Today's medical-centric topic is hay fever cough, causes, diagnosis, and treatment. Hay fever, also known as allergic rhinitis, is a common condition that can cause a variety of symptoms, including a persistent cough. Understanding the causes, diagnosis, and treatment of hay fever cough can help manage this irritating symptom effectively. 1. What is hay fever cough? Description: allergic reaction. A cough caused by the body's immune response to allergens such as pollen, dust mites, or pet dander. Common symptom: often accompanies other hay fever symptoms like sneezing, nasal congestion, and itchy eyes. 2. Causes of hay fever cough. Allergen exposure. Pollen. Grass, tree, and weed pollen are common triggers. Dust mites and mold. Indoor allergens can also cause hay fever symptoms. Pet dander. Proteins found in the skin flakes, saliva, and urine of furry pets. Postnasal drip. Mucus production. Allergens cause increased mucus production, which drips down the back of the throat, leading to a cough. Airway irritation. Inflammation. Allergens can cause inflammation in the airways, resulting in coughing. 3. Diagnosis of hay fever cough. Clinical evaluation. Medical history. Detailed history of symptoms and potential allergen exposure. Physical examination. Examination of the nose, throat, and lungs. Allergy testing. Skin prick test. Small amounts of allergens are introduced into the skin to check for reactions. Blood tests. Measuring specific IgE antibodies to various allergens. Additional tests. Nasal endoscopy. To examine the nasal passages and sinuses if symptoms are severe. Pulmonary function test. To rule out other causes of chronic cough. 4. Treatment of hay fever cough. Medications. Antihistamines. Reduce the allergic response and alleviate symptoms. Nasal corticosteroids. Reduce inflammation in the nasal passages. Decongestants. Relieve nasal congestion and reduce mucus production. Leukotriene modifiers. Block chemicals involved in the allergic response. Allergy immunotherapy. Allergy shots. Gradual exposure to increasing amounts of allergens to build tolerance. Sublingual tablets. Placed under the tongue to reduce allergic reactions. Home remedies. Saline nasal rinse. Helps clear allergens and mucus from the nasal passages. Hydration. Drinking plenty of fluids to thin mucus. Humidifier. Adding moisture to the air can help soothe irritated airways. Lifestyle adjustments. Avoiding triggers. Reducing exposure to known allergens. Cleaning. Regular cleaning to reduce dust mites, mold, and pet dander. HEPA filters. Using air purifiers with HEPA filters to reduce airborne allergens. 5. Managing hay fever cough. Preventive measures. Monitoring pollen counts. Stay informed about local pollen forecasts and limit outdoor activities during high pollen times. Protective measures. Wearing masks and sunglasses outdoors to reduce pollen exposure. Support networks. Healthcare providers. Regular consultations with doctors or allergists for personalized treatment plans. Support groups. Connecting with others who have hay fever for shared experiences and tips.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.